अस्सलाम वालेकुम, वेलकम बैक टू डॉक्टर तारिक RYK। आज का जो हमारा टॉपिक है बेसिकली वो है बोन्स ऑफ द अपर लिम्ब और द एनाटमी ऑफ द अपर लिम्ब बोन्स एंड अपर लिम्ब bones. We will see every bone in the three-dimensional view and we will discuss each and every clinical points of the upper limb bones. If you are new on our channel, like, subscribe channel and on the notification bell for the upcoming videos. Let's start our topic. We will today discuss about the ulna. Ulna is a bone of the forearm. They are present in the medial side of the body. The forearm consists of two bones, radius and ulna. Ulna is the medial bone and radius is the lateral bones. Ulna, see, this is the anterior view of the ulna. Anteriorly, if you see the ulna like this. Ulna is a long bone. It consists of two parts, proximal, distal, and the middle is the shaft. If we see ulna from the proximal to distal, here is the olecranon process of the ulna that is in the olecranon fossa of the humerus in the elbow joint. This is coronoid process of the ulna that articulate with the coronoid fossa of the humerus, and here is the radial notch of the ulna. In it, the radial head articulate in the elbow joint. Here is a ulnar tuberosity that attach with the neck of the radius, and here is coronoid process that attach with the coronoid fossa of the humerus. This is the trochlear notch of the ulna, and here is the supinate crest. Here is the supinate teres muscle get its insertion. This is the anterior surface of the ulna. Here is the anterior border, anterior surface, anterior border. This is the shaft part. If we see the distal part, we will see the head of the ulna. Here is head of the ulna. Note that ulna is the only long bone that has its head on the distal part. Other all long bones have head on the proximal part. This is the anterior of the ulna, anterior landmark of the ulna. Now see the posterior mark of the ulna. This is the posterior view of the ulna. Posteriorly, ulna look like this. This is the proximal surface has the olecranon or pulley shaped process. This is the olecranon of the ulna. Look, here is, and here is a supinator crest. This is the supinator. This is the supinator crest. Here is the posterior border of the ulna, and in the distal part, here is styloid process of the ulna. Styloid process present in the posterior medially. And in bone we have a interosseous border. It is present in the laterally that attach with the medial border of the radius to make the syndesmosis. Now we see the lateral view of the ulna. This is the lateral view of the ulna. This is the lateral or the radial side of the ulna. In proximal part, we will see the olecranon. This is the pulley shaped process of the ulna that fixed in the olecranon fossa of the humerus in the elbow joint. Proximally, ulna is joined with the humerus and the radius to make the elbow joint, and distally it attached with the radius and also with the lunate and small portion of the scaphoid to make the rest joint. Here is the olecranon process, and here is a trochlear notch in the olecranon process. Here, and here is a radial notch of the ulna where the head of the radius is attached, and here is again supinator crest. Here is the supinator teres muscle attached, and here is coronary process of the ulna that get its articulation with the coronary fossa of the humerus. And here is laterally is a lateral border or interosseous border of the ulna, and here is anterior surface, and this is the head of the ulna distally. Let's see medial side of the ulna, how medially it look. If you see medially, ulna will be like this. From proximal, this is the olecranon process, and here is a trochlear notch, and here is the ulnar tuberosity. This is the ulnar tuberosity here. If you see, this is the shaft, and it has the border within anteriorly, but in distally we will see here is the head of the ulna, and it is posteriorly is the circular process of the ulna. This is the medial view of the ulna. Now see the superior view of the ulna. If we see superiorly from the arm to forearm, ulna will be like this. This is the olecranon, again olecranon process. This is the trochlear notch, and here is a coronoid process of the ulna. Here is a radial notch of the ulna. Here is a interosseous border, lateral border of the ulna in the shaft, and here is a supinator crest. And if we see below or distal part, here is the head of the ulna. Here is, and the below the head is the articular surface of the ulna for the carpal bones. This is the superior view. If we see from the inferior view, ulna will be like this. This is the inferior view. This is again the articular surface of the ulna for the carpal bones, unit, and the small portion of the sacrifice. And here is a cellular process of the ulna. This is the inferior view, and proximal part is here is ulnar tuberosity that attached with the radial neck. This is the inferior view. Now this is the anterior view. You can note anteriorly how ulna look like. This is the ulnar tuberosity. Ulnar tuberosity here. This is the anterior border, head, and the styloid process. If you see anteriorly, ulna will be like this. Again, posterior view, you can see this is the posterior border of the ulna. Ulna has border, posterior border, and other is the lateral border or interosseous border, and third one is the anterior border. Posterior border, lateral border, and the anterior border. Ulna has a three border, but it has a three surface: anterior, posterior, and the medial surface. This is the medial side of the ulna. Here is a lateral view. Laterally, ulna joined with the by a shaft with the radius to make the syndesmosis by the syndesmosis membrane of the radius. That is a lateral view of the ulna. So I hope you will understand about the ulna. If you have any question or any confusion, you can make comment. See you for next. Allah Hafiz.